Good day, my dear patients. I am Dr. Thanga Thirupathi Rajan, consultant neurosurgeon in Billroth Hospital. Today I am here to relieve you of your fear of neurosurgery. So, neurosurgery is associated with the stigma of intense fear of ICU, poor prognosis, and prolonged hospital stay, which are all myths which I am going to bust now. So, most of our patients, the first myth I like to bust is that most of the patients who come to see me in OPD cases do not undergo surgery. Only 30% of the patients who come to see me will require neurosurgery. So it's known, you not come fear to get a consultation with a neurosurgeon. Most of you can be cured or given relief with medications. The second thing is about the outcome. Neurosurgery has very good outcome if done for the proper patient at the proper time. So this is the most important thing. As in any other specialty, like you operate for a hernia, hydrocele, or you can operate for any abdominal conditions. You come early, the prognosis and the risks are same as that as operating in any other part of the body. You need not fear that the risks are very high with brain surgery. Actually, the studies tell that the risks are almost same if operated in appropriate time. And so, the three things I like to which commonly comes up in our conversation is first is trauma. That means you have a head injury. How is the outcome? Outcome depends on two things. How severe is the injury and how early you come to the hospital. The earlier you come to the hospital, the better your chances are and the risks are less. And the mild head injury and moderate head injury, people do extremely well and they get back to their normal life. Second thing is about brain tumors. So there is a big stigma with brain tumors, especially after all TV and movies. Brain tumor means 1 month, 2 months. That's absolutely a myth. Only 10% to 20% of the brain tumors have very poor prognosis. Almost 70 to 80% of them have very good prognosis. And a lot of tumors have operated, patients get back to their normal life and live out their lives very happily. And the last thing I like to do is spine. So there's another myth that if you operate on spine, you have to bedridden, be long, you'll not be able to walk. Now the technology has progressed, procedures have progressed so advanced that now I'm doing endoscopic spine surgery where the patient next day goes home walking. After 1 day of surgery, disc and other small things, patient can go home walking the next day. So these are the myths I like to bust. And so don't get rid of your fear of neurosurgery and come and get a good consultation if required with a neurosurgeon. Thank you.